I am primarily an emergency room physician. I work at Person Memorial Hospital in Roxborough. I'm on maternity leave right now. I also work at UNC Urgent Care, and I have worked in adult primary care as well. I think not enough people have insurance. Everybody should have insurance. But I also think that a lot of us are underinsured right now. And the proposed solution kind of continues this piecemeal system we have, where you're either getting it from your employer, from the government, buying it out of pocket, your insurance. It's never quite clear where you will get your insurance, how you will afford it. And then even if you have insurance, the practitioners are beholden to the insurance bylaws to determine which tests and which therapies for which a patient qualifies. So you can't necessarily get the care you need even if you have insurance. And then if you get the care that you need, you still have to advocate for yourself when you get that bill, because you don't know if your claim was just denied reflexively or denied on some grounds, and you have to spend hours on the phone fighting it. It's really not working. I don't think it's working for almost anyone. Universal health care, single payer universal health care, like Canada, England, a lot of socialized democracies have a system that is free, essentially free, comprehensive health care for everybody. It is totally feasible. I think we spend about 1/3 of our healthcare dollars on administrative overhead. If you think about all the people working in your physician's office and the insurance office to fight with each other about who's going to pay, we don't need them. And so there's all this administrative overhead we can use to fund a universal healthcare system, and we can increase taxes on the people who are billionaires if we needed extra money. But I do think that reducing the waste in our current system, the administrative overhead, and just the inefficiency of our current system would probably pay for this primarily. And if not, you know, there's some people have plenty of money. I guess I'm pleasantly surprised about the momentum for this in this country. This is a kind of scary time for America. Things are changing a lot, in a lot of ways for the worse politically, and I think this would be a huge step in the right direction in so many ways, in a way that would spill over from how we feel, how healthy we are as individuals, to how healthy our families and communities are, to really the extent to which we can welcome foreigners into our country, and the power that we feel, you know, that the 99% feels. Just knowing that we have something that is fair and right and good, and that this system where some people are calling all the shots is just not going to continue. Calling all the shots and hanging on to all the wealth. It's just not going to continue. We're not going to tolerate it. So that's kind of what I would add.